Everybody high. Amlodipine is one of the most recommended antihypertensive drugs in patients with systolic hypertension. Systolic hypertension usually occurs in the elderly and is even called hypertension in the elderly. Amlodipine effectively lowers systolic blood pressure with little effect on diastolic blood pressure, and it is good at this. The problem, however, is that after some time after starting treatment with this drug, edema often develops, and this is the reason for replacing it with another. The best option here is so-called levorotatory amlodipine or L-amlodipine. With it, edema goes away. But this does not always happen, since in a small number of patients, edema may return while taking L-amlodipine. The question arises what to do. I'll answer. Just start taking it less often, for example every other day, and so on, choosing the frequency of admission at which blood pressure will be controlled with the disappearance of edema. It's easy to figure out. Edema on L-amlodipine develops over time in the so-called slow metabolizers, when the drug is slowly destroyed and the problem is solved by reducing the frequency of its intake. Thank you for watching.